Most of us take eating and drinking for granted. It is a normal, essential and enjoyable part of life. However, some medical conditions can mean that it can become difficult to eat and drink safely, or take enough to meet your nutritional requirements. Sometimes it is difficult to physically eat due to weak muscles, pain or blockage. Sometimes medical conditions mean you lose your appetite completely and can't face eating. The reasons and conditions can be many and varied, and can affect people of all ages. If a member of the team dealing with your swallowing and nutrition feels that your ability to meet your needs or to eat and drink safely is not adequate, then there are choices available to you. This DVD and the booklet that goes with it is to help you to make an informed decision about your ability to eat and drink safely, and to think about the different options that are available to meet your nutrition and hydration needs. We will explore a positive and practical approach to gastrostomy or tube feeding, and help guide you and your family to a decision that is right for you. Swallowing requires lots of muscles to work in a coordinated fashion. Let's take the process of swallowing step by step. In the first stage of the swallow, the food is chewed well, mixed with saliva, and formed by the tongue into a ball or bolus of food. The tongue then pushes the bolus to the back of the throat, ready to be swallowed. In the second stage of the swallow, a small, important flap of tissue called the epiglottis folds over the entrance of the airway or windpipe and prevents food, drink or saliva going down the wrong way. And in the final stage of the swallow, the esophagus contracts and moves food toward the stomach. When you're not able to swallow well, this can be distressing. It can become a struggle, and as a result, eating can take a long time or even become unsafe, as there is a risk that food or drink will go into the lungs by mistake. This can result in a serious chest infection and make you very unwell. If you are struggling with eating or meeting your nutritional needs, you will have met some different healthcare professionals who can help you. These can include your GP or consultant. You may also have a specialist nurse who can provide support and information to you and your family. And you may be referred to see a speech and language therapist or a dietitian. If you need her, a speech and language therapist who is the expert about swallowing will see you to work out if there are things you can do to help make swallowing easier. This may include strategies to help the muscles, or they may advise you to take a specific texture of food that is easier to swallow. It may be that you're also advised to have your fluids slightly thicker, as this can give your muscles time to get into position so you can swallow drinks safely down the right way. If people are struggling with eating and drinking, or taking enough to meet their needs, there are a number of things that may have already been advised. For example, taking food and drinks little and often helps ensure that the muscles involved in swallowing don't get so tired. People would aim for smaller meals and have snacks between meals. You may be encouraged to take richer foods so that you get more calories and goodness from the food that you do manage. For example, some people find they cope well with red or full cream milk in milky drinks, and that having full-fat yogurts and custards with desserts or extra cheese on main meals all help toward building their calorie intake. Some people like to have extra snacks like chocolate or cake. You will have been referred to a dietitian if you continue to struggle to meet your needs or maintain your weight. The dietitian is the expert about nutrition and will be able to assess how much you need, how much you are having, and to advise you about different foods to help you keep strong. The dietitian may also advise you about some nutritional supplements that you can get on prescription from your doctor. The dietitian and speech and language therapist will often work in close collaboration, especially if you also have swallowing difficulties, in order to best advise and help you with your own particular requirements. If you are having difficulties meeting your needs because of a physical problem, for example, unable to get the food from your plate to your mouth, there are a number of items available that can help with this. Members of your team will be able to refer you to the occupational therapist, who can provide things like adapted cutlery or even a special plate that has a rim which makes it easier to put food on your fork. You may find having someone to help you eat is the most reassuring and helpful thing. For some people, getting support with their swallowing difficulties and help with eating the right foods may be the best way to plan their care. However, if you have already tried all these things, or if your condition has developed suddenly, you may be advised to think about being tube-fed. Tube feeding is recommended to give nutritional support if someone is not able to eat or drink in the usual way safely, or if they can't meet their needs. It allows medication, water, and what we call feed, a milk-based food which comes prepared in a ready-to-hang bag, to be given directly into the stomach using a pump. Nutritional support is important as it can prevent weight loss, help people who need to put on weight, help overcome weakness or tiredness, make sure that people are getting enough liquid, ease the pressure of having to eat, especially if someone is having problems swallowing or finding it difficult to eat. Some people, if assessed by the speech and language therapist to be safe to, can continue to eat and drink what they want, or are able to safely manage, and only use the feeding tube to top up their nutrition overnight or during the day. Some people will not be able to eat or drink safely and will need to rely totally on tube feeding to meet their needs. The first way some people are tube fed is with a tube that is placed up the nose and down into the stomach, a nasogastric tube. This is a little uncomfortable at first, but once placed is a quick and easy way for you to be given water, your medications, and to start on a feed regime. Nasogastric tubes are used when somebody requires tube feeding for the short term, for example, 4 to 6 weeks. If you need tube feeding for the longer term, the best option for most people is to have a percutaneous endoscopic gastrostomy, often referred to as PEG. With the PEG, a soft plastic feeding tube is surgically placed through the abdominal wall and into your stomach. Through this, as with the nasogastric tube, water, your medication and your feed can go directly into the stomach. The advantages of a PEG include PEG feeding is flexible around your needs. Where possible, you can combine PEG feeding with oral intake, eating and drinking. This eases the pressure of having to eat and drink. On those days you eat and drink well, you may only need your PEG to top up your nutrition and hydration, but on those days that you don't eat or drink well, you can use your PEG more. A tailored feeding plan. Your dietitian will give you a feeding regime that is individual to you. Some people prefer to be fed with a pump that controls the flow of feed into the PEG tube. Others prefer to have bolus feeds by using a syringe to put the feed or a supplement into the PEG tube, or you can have a combination of the two. PEG feeding is an easy way to be well nourished and hydrated. Because of this, you will feel more energetic and be able to go about your normal life. It is an easy way to have your medication. It is discreet, can be tucked under your clothes. Secure, not likely to fall out. Unlikely to cause pain or irritation. and if cared for correctly can last for a number of years and can be removed if no longer needed. Your team will advise if a PEG is the best course of action for you. A PEG is most effective when used early on in your treatment, as it will prevent you losing further weight, will help you gain weight, and keep your energy levels up. Generally, it can improve your quality of life. With some medical conditions, for example, progressive neurological conditions, it may be advised that a PEG is inserted earlier rather than later. If left too late, it may not be possible to put one in. John has decided to have a PEG because he knows that his swallowing is gradually getting worse, and on bad days he sometimes chokes. He is going to the day patients unit, where his gastroenterologist is going to insert the PEG. Staff in the unit will address any concerns he may have. John is going to have a flexible scope with camera and light passed down into his stomach. This will allow his surgeon to see inside the stomach and illuminate the best place to position the PEG. Once the incision is made, the soft plastic feeding tube is passed through the stomach wall and held securely in place both internally and externally by a plastic bumper. Typically, the PEG procedure is done under moderate sedation, so John will be awake for the procedure but made very drowsy. The actual placement will only take around 10 minutes. John will then stay overnight in hospital to check that he is okay. The hospital team will keep him comfortable, as the site of the PEG tube placement can be sore immediately after the procedure. 4 to 6 hours after the PEG tube is inserted, it can be used, initially for water, and if all goes well, then John will start his special feed. He will need to learn about the feeding pump and how to take care of his PEG tube and PEG site in order to prevent infection. The dietitian will devise a feed regime that is individual to John and anyone who has a PEG. If all is well and John is established and comfortable with his PEG and feeding regime, he will go home the next day and will be using his PEG for water and nutrition. If needed, John can have the community nurses visit at home to begin with to help with the setting up and taking down of the PEG while he is getting used to it. Following discharge from hospital, your team will be in regular contact to make sure you are adjusting to life with the PEG and are only a phone call away. Your dietitian will regularly monitor how much feed you need and will also arrange for the feed and all the equipment that goes with having a PEG, for example, syringes, feeding tubes, pumps, etc., to be made available from the pharmacy of your choice. Your speech and language therapist will continue to assess your swallowing and check what is safe for you to eat and drink. And your nurse specialist will continue to support you and your family, making sure that everything is working well for you. With a feeding regime that is tailored to meet John's needs, daytime pump feeds in conjunction with eating and drinking small amounts, he is able to lead his life as usual. John uses a backpack to discreetly carry his pump and feed around while shopping, out with friends, and pottering around the house. One question that is often asked is if someone with a PEG is able to swim. The answer is yes. It may just be suggested that the tube is taped to your body to reduce the risk of it getting caught on something or accidentally pulled. Another question asked is if someone with a PEG is able to travel and go on aeroplanes. Again, yes. You will need a letter from your doctor or dietitian explaining why you have to carry so much liquid with you. Other than that, you can travel normally. Some people may need to have their PEG tube for life. For others, it is a stepping stone to being able to manage to eat and drink safely again. It totally depends on individual circumstances, and the reason the peg was required in the first place. A peg can be removed if no longer needed, and the site will heal. Far from being disadvantaged by peg tube feeding, people feel more energetic and have an improved quality of life because they no longer struggle to be well nourished and hydrated. As a result, many people have gone on to lead a normal and active lifestyle, thanks to the peg.
When a peg was first mentioned to us, it was very daunting and very medical, but it wasn't like that at all. It totally takes the pressure off worrying about getting medicines in her, getting food in her, and we don't have to talk about that all day constantly. Our days used to be spent with, right, you've got to eat this, you've got to do that, you've got to do this, and now we can just get on with enjoying ourselves, and there's no problem at all.
I found it beneficial because the major operation I had left me with an intolerance to sweet stuff. I finished it with a sugar dump, very much like a diabetic, hungers, lightheaded, severe diarrhea. But as I say, I think this is good. I think it is helpful. I think it's nothing to be afraid of.
Okay, Jack's had his gastrostomy about 6 years now. Prior to having it, meal times were a particularly stressful time for Jack and ourselves. Jack, because it wasn't a pleasurable experience for him, and we were having to force him to eat because there's a lot of pressure on him to perform and a lot of pressure on us to make sure that he had everything that he needed. But since having the gastrostomy, the pressure's been relieved. It's a much happier family life. Meal times are much more pleasurable. There's no pressure on him to make sure he eats or drinks, and it enables us to be able to make sure he gets everything he needs by topping up. The other thing I would say that has been particularly helpful is when Jack's ill, we can give him sort of prescription milk or fluids to keep him hydrated and give him what he needs.
I want to stress there's no pain. I've had no pain whatsoever through the whole procedure and no discomfort. So I don't feel that I'm having it. I can do almost anything I want to. It's made a big difference to my life because I didn't know I was so low. And now I'm fit and well, better perhaps even before. Years ago I haven't been well. Now I'm fit and well, and I'm very happy to have it. I really couldn't do without it now.